What do you make of a patient testing positive in New South Wales on day 16? It seems it's a weak reading.
Well, we need to be careful about not overreacting to that. I mean, the reality is that if you have a very low level of infection, which we call a high cycle number when we do the PCR test, then there's not much virus there. Now, that can either mean you're in very early part of your infection and it's going to get worse, but that seems very unlikely with this lady or this person, or it may mean you had an infection quite a while ago and it's just intermittently being detected. In Korea, they found that a large proportion of people who had COVID were still positive a month and some even 2 months afterwards. And all the evidence is that those people weren't infectious to others. They did a lot of close contact tracing, et cetera, et cetera. So in this particular one, it is very likely that this person may well have had an infection sometime previously while they're overseas. For whatever reason, it wasn't positive when they were in actual quarantine. And for other reasons, it's come up positive. For instance, I've seen cases where in the hospital I work at, where we've seen people who are positive, who had probably had the infection a couple of months before, have a second infection like the common cold, and that seems to stir up enough things for the virus to be released, even though the COVID virus, there was no evidence that it was active at all. So we need more information, but let's not get, I think, overexcited at this stage. The reality is 99.9% of people who develop COVID do it within 14 days of exposure. And therefore, I can't see any need to, increase the quarantine period at all so far, based particularly on this one case when we know you can have the virus found many weeks, if not months later after your initial infection.
Okay, another worker tested positive in Victoria. What are you advising now is the best thing to do with hotel quarantine? You're on this program just last week saying we don't need to overreact here about the airborne disease and how that is transmitting, but what extra precautions do you think we should put in place?
Well, I think there seems more evidence that the rooms that people are in because of the air conditioning are what we call positive pressure. That is the opposite to what we do in hospitals where we put these people in negative pressure rooms. Now, what that means, if you're in positive pressure, the air in the room flows outside when you open a door or a window or something, while negative pressure goes the other way. So if you've got an infection and it flows out, it means if there's any infectious particles, droplets or whatever, they can go at least out in the corridor. And given a lot of these people are opening the doors, I heard on one occasion in one of the states where there was an infection of a security guard, somebody had opened the door 8 times in an hour for parcels and pickups. And in general, they're not wearing masks. So what I think we need to do is 2 things: open doors less often. And if people do open the doors from the inside as guests, they should be wearing a mask when they open the door to decrease the chance that they could spread anything in the corridor. But I think anybody in corridors who are sitting there need to wear a face mask while they're there, and also a face shield, because I think we're underappreciating how important our eyes are. Our eyes are probably just as important for a receptacle for droplets to, drop into our eyes, because if they go into our eyes, they quickly go to the back of your nose through something called the nasolacrimal duct. So just protecting your nose and your mouth isn't enough. We need to protect the eyes if you've got a lot of community transmission or you're in a high-risk situation. So I think we need to improve that. But on the bright side, if you look at the Queensland report that was put out last week, only 4 of those people had identical strains. You might remember there was a lot of hoo-ha about aerosols going through the air conditioning, infecting lots of people. Well, I think the available evidence from that is that's not likely. It was a strain that's more infectious, the UK strain, but it really only went to a cleaner who gave it to her husband, and they're obviously pretty close contacts and a lot of contact with each other. All the other people she'd in contact with didn't get it. So that's reassuring that this is not as bad as people are making out. And also the Lebanese couple, from what I can see, is they did not have identical strains. They could as easily have picked it up in Dubai, where I think they stopped, or even in Lebanon where they came, and there's a lot of UK strains. So I think the available evidence at the moment is that, yes, you can transmit this to hotel workers and quarantine workers. For a cleaner, it may be via their hands as much as, breathing in. We just don't know. But what we do know is we do not have large numbers of people in hotels sharing air conditioning coming down with infection. And we also know when we inevitably, and this will unfortunately occur for the next year, get some people, staff, security, etc., infected, that so far we have been very good at stopping further transmission in the community by contact tracing and testing and the public being on side. Yes, Victoria last winter was a real disaster, and we don't want that to happen again. But there were a lot of things that were not done properly: training of
Okay.
security guards, not notifying where people were infected, people infected not being at home, etc., etc. All of those have been fixed. And if you look at Melbourne last December, when they had that cafe of 30 cases, and in fact the last two security guards that have been infected, or hotel workers, there hasn't been spread that hasn't been contained. So yes, we don't want it to go to staff in hotels. Yes, we can do better. But equally, we've got all this other, case control testing that has worked very effectively throughout Australia for every cluster we've had, no matter when it's occurred, with the exception of Victoria last winter. But all the rest have been brought under control without the need for lockdowns, or lockdowns aren't making any difference, just relying on case finding, lots of testing, and the community cooperating with reasonable direction.
All right, just finally and quickly, AstraZeneca has revealed that the vaccine has little effectiveness against the SA, the South African strain, that is. Are you worried about that?
Well, I'm not sure AstraZeneca did say that. There was one small report from South Africa that showed it didn't make much difference in their relatively small study. I don't think it means it doesn't work at all. We just don't know, and we need more data. So I think don't panic at this stage. We need more data. It'll become pretty obvious as time goes on. But so far, as far as I can see, most of the data on AstraZeneca, it does appear to work against all strains, like the UK strain that people said it won't work against. This is a very small study with huge confidence intervals as to whether it worked or didn't work. We need more data. And so far, the evidence is all the vaccines appear to work, at least in part, and at least to stop probably the most serious disease against all the strains, but we need more data.